The Connecticut Health Council was formed back in 2012 as an initiative of the Alliance, and it is designed to promote the significant health sector assets that we have in the state, and by promoting them, ensuring that they become an ever more effective driver of private sector employment growth and private sector investment.
You know, it really reflects what's going on in healthcare today from both the national perspective and the local perspective. And a lot of the problems that are happening at the local level, of course, are happening at the national level. So it's great having the leaders from Connecticut here to be together and discuss these important topics.
Came down to DC because this is a unique opportunity. Come to Washington, we hear from speakers, and then you go back and it's more the same. This is different because we're bringing leaders from the healthcare sector from Connecticut to come and hear common themes, but to put our heads together and say, how do we innovate? How do we take what we hear here and learn and take it back to Connecticut so that we can make a contribution to the economy and create jobs?
I think it's important to get the perspective of CMS and HHS, and I think it's important to dialogue with them because these were leaders and they set policy. They lead for us in Connecticut, and we can utilize their policy, we can utilize the grants that they have and understand their way of thinking so that we can become an even greater contributor to the economy in Connecticut.
And here we are in this magnificent city with this event, which is a culmination of a whole lot of work, and it basically shows how the Health Council has taken hold in Connecticut and frankly really taken off. And it's terrific for me as a sort of founder to see what this whole thing has in fact become.
I think that one of the things that's really great about this trip is we have the opportunity to interface with our leaders in Washington, because so much of healthcare is not only local, it's also national. And so that ability to kind of bridge our geographic gaps and take our learnings from the Connecticut market and see how we can apply them more broadly was a really enticing opportunity.
Do you feel as though the forum brought you the types of creative, the types of relevant and valuable types of information and perspectives around not just Connecticut, but as well important healthcare innovation topics?
And so what we're trying to do here by being in DC is make sure that our delegates get a holistic picture of all the different aspects of healthcare in Connecticut to, one, make sure that the system itself is delivering great benefits for individuals, but also really to help support the Metro Hartford Alliance in conveying the notion that if you're looking for innovation, if you're looking for intelligence, if you're looking to do something that's really unique in the healthcare space, Connecticut is a hub for that kind of activity, and it's a great place for resources to help you meet your goal in that regards.
And I'm so happy to be able to be a part of this. I've heard so many wonderful things from my colleagues today. A lot of themes are emerging, which is not really surprising, that we would hear from the different hospitals and all of the other stakeholders involved in healthcare within our state.
We had an opportunity to meet with our legislators and meet with a diverse group of people from Connecticut, business community, from every part of the industry, from education to hospital administration to pharmaceutical companies.
So I think, our collective discussion was around maybe we start by segmenting the markets.
Contributor we are to the economy and looking at all the different aspects of healthcare providers, payers, entrepreneurs, different ways if we can gel that and create an aligned vision.
I think if our goal is to convince others, whether it's public and private, about the wisdom of investing, we've got to be able to make our case.
We're absolutely very grateful for the sponsors that have, the entities that have sponsored this forum. Without it, it wouldn't have happened. And as importantly, several of the sponsors have been very involved in shaping the program itself. So it's not just been the financial support that they provided, but the support that they provided in helping shape the agendas, identifying speakers. For example, we wouldn't have had Dr. Patrick Conway without Connecticut Children's Medical Center and the relationship that exists there. So that's invaluable to us.